Okay, well, welcome to our HealthSpan podcast. Today, we are going to talk about preventing dementia. Our dementia is predicted to triple in the coming decades. It's actually gone up 88% in the last 2 decades, so very frightening numbers. And I wanted to do a podcast that was focused particularly on dementia because it is a topic that I hear a lot from my patients about. Their concerns about, potentially having dementia in the future. I hear from my patients about loved ones that they have that have dementia and how frightening and challenging that is, and what most people don't understand, and frankly, I didn't either, was that a lot of dementia, a significant percentage of dementia is actually preventable. And that's what we're going to focus on today, the science behind prevention. So I'm your host. I'm Dr. Robert Todd Hurst. I'm a preventive cardiologist and founder of HealthspanMD. And I am joined today by my colleague, Rylan Hoffman. She is the lead health coach for HealthSpan. And excited to have you here, Rylan.
Hi, Dr. Hurst. Excited to be here. And I have to say, I'm looking forward to discussing and, of course, learning from you about this topic. Like you said, dementia is a huge concern, particularly Alzheimer's. And it's generally thought about as something that you don't have control over. Like if you get it, you're out of luck kind of thing, or you have unlucky genetics or something like that. And though that plays a role, now today we're going to talk about how you have a lot more control than you realize. And I think that's a really relevant, exciting topic.
Yeah, so we're going to talk about research that shows that people can lower their risk of dementia by 41%, which is a big number, dramatic number. I want to put that in context. I know sometimes people can get confused about this, or maybe led down the wrong path. I remember, somebody who was famous in the world who had said that, well, I don't get the flu shot because it's only 40% effective, and I don't like those odds. I think it was a misunderstanding of this, saying that, well, and I can understand you look at it one side and say, well, if it's only 40% effective, it still leaves me with a 60% chance of getting flu, and that's true. But what I think is missed in this is that getting the flu is a terrible thing, right? And you can lower that by 40%. I don't know, if you've had experience or seen somebody up close lately in the last few years that have had the flu. It's not something you want to mess with. And so for me, it's a no-brainer for me to get the flu vaccine. But I think the same thing for dementia. Like, keep this in context. 40% reduction of something that you absolutely don't want, multiple times worse than getting the flu, lowering that. But also I want to emphasize two other things. One is, actually, I think the number is higher. What we're going to talk about with the research, I think there's additive things on there that we address in our HealthSpan programs that are going to even further lower that percentage. But also, I want to emphasize that it's not just preventing dementia. These same things that we're going to be talking about, most effective ways to avoid heart disease, the number one cause of death, the thing that 60% of us are going to have in our lifetime. Also, the most effective way of avoiding cancer, the most effective way of not getting diabetes, the most effective way of controlling your weight, of lowering your blood pressure, of helping you live a high quality, long life. So it's not just about preventing dementia, but that's, I would say, just, an even more higher added bonus to what we're going to talk about. So, dementia is something that has been very impactful for me personally. I distinctly remember when I was a young boy going to see my great grandmother, who was in a nursing home and suffering from dementia, and it was a frightening experience for me. I was quite young, maybe 8 or 9 years old, and I just didn't understand how this exceedingly old person, had no idea who I was, actually thought I was my dad and thought my dad was my grandfather, and wasn't able to carry a conversation. I just, that was really a pivotal moment for me that really hung on for quite some time after that. Later in life, I started to recognize, three of my four great grandparents had significant dementia at the end of their life. All four of my grandparents had cognitive decline at the end of their lives, although they weren't diagnosed with dementia. They hadn't progressed to that point. But even more so, seeing it firsthand in my patients that, at our start of our relationship, they were cognitively intact. We, had really great conversations, how that progressed to the point where they were not able to participate in their care, really participate in conversations anymore. But maybe even more impactful for me was seeing the effect on my patients who had spouses that were suffering from dementia, and how devastating that was. So, I understand people's concern about dementia and how that's on the list of, boy, don't want that for all of us, because not only does dementia take away who you are, that's frightening enough, but also the tremendous burden it's going to put on your loved ones when you get it. So I don't think I have to discuss any further, like how important, avoiding dementia is. But let's turn it now over to the hope in this, and that you have a lot more control over dementia than you may have thought in the past. Um, so who's at risk of dementia? Obviously people that have a family history are concerned, like me. And there's absolute truth to that having a family history of dementia does increase your risk of having dementia. Maybe even more common these days that I see people who are concerned about their dementia risk is because of genetic testing. They've done a 23andMe or other DNA test, and it is shown that they have at least one of the ApoE4 genes, and that indicates a higher risk for dementia, and they're very concerned about that, and rightfully so. I guess I want to just say a couple of things about the ApoE gene. Is that, there's ApoE2. This is protective, but you almost never see it. I've not seen anybody yet with an ApoE2, although I know they exist. It's single digit percentage of people. Most people are in the ApoE3, which is neither good nor bad. But then about 25% of us have the ApoE4 gene, which increases the risk of dementia 2 to 3 times. So, and then for rarely people have both copies of the ApoE4, and about 2% of people, that increases the risk maybe 10 times for dementia. But what I'd emphasize, if you do have the ApoE4 gene and it's important that you know that still most people do not develop dementia. So I've often seen patients who have kind of a, there's nothing I can do. This is just going to happen. It's, the fate is, the die is already cast, when in fact, that's not true at all. In fact, I'd say that's a real opportunity. That's something where you can say, okay, now I understand the stakes. I really need to focus on what I can do to prevent things. And you have a lot of control over that prevention of dementia. So, I mentioned a couple of times already their research study that showed that those people who are able to do 7 things, they have 7 characteristics of their health, lower their risk, or have a 41% lower risk of dementia. And these are called Life Simple 7. They were originally created or identified as a really great framework for preventing heart disease. Turns out it prevents dementia quite effectively as well. So those 7 simple things: normal blood pressure, normal cholesterol levels, normal blood sugar numbers, healthy body weight, and then being moderately physically active. That's meeting the minimum guidelines, 150 minutes of moderate level activity weekly, eating a nutritious diet, and then not smoking is the number 7 thing. So these are great. Life Simple 7 is very powerful, and really one of these are all included in our HealthSpan 10 that we talk about with our patients about the 10 factors that we have control over that are most powerful in predicting your health, your weight, your risk for future heart attacks, strokes, dementia, cancer. That's the foundation of these is Life Simple 7, but we add on to that other additional factors that are really important as well. I recognize this as a practicing cardiologist, and so I added those three things in, and we call that the HealthSpan 10. So what are the things we add? Number one, restorative sleep. How critically important getting sleep is for our health. The ninth thing is effectively managing stress. I think stress has flown under the radar as importance in determining our health, but chronic stress has really become epidemic, where there's lots of different potential culprits here, whether it's technology, whether it's long working hours, whether it's lack of social connection, whether it's social media or our phones, or the news media. All of these things are being discussed, but the bottom line is that our chronic stress levels are rising, and it's having a severe negative effect on our health. And then lastly is staying connected both socially. That does not mean social media. That means real conversations with real people, but also staying connected to your purpose, to your contribution, engaged mentally, learning new skills, solving problems, and along with particular importance in preventing dementia is treating hearing loss. That's one of the interventions from a medical standpoint that can have a real impact. People who have hearing loss, they don't treat that, much higher risk for dementia. And then the last thing I'll add is that, in the Life Simple 7, the toxin they identified was smoking, and so that was what was included. But there are other toxins as well. We talk about excess alcohol being a potential toxin that has been associated with increased dementia. But there's also toxins like social media, like the news media for some people, some prescription medications, some supplements as well. Rylan and I have had that experience with patients who are on just armfuls of supplements that are not serving them, and potentially having negative effects on their health as well. We're not, in fact, next week we're going to talk about, or next podcast we're going to talk about supplements. It's not an all or none thing. I don't think that saying that no supplements are potentially helpful. I don't think that's a true statement. I think supplements can be part of a healthy lifestyle, but they're not a replacement. They don't make up if people aren't active, if they're not eating well, if they're drinking too much. Supplements aren't going to be helpful in that, but also being very particular, and we're going to talk about that intentional approach to supplements next week. So that's our HealthSpan 10. I am convinced that this is going to lower the risk of dementia more than 41%. I don't know what that number is, but I'm going to give myself every chance that I can to avoid dementia. I plan on being around for a while, if God willing. I don't have all the control on that, but also for my patients. This is what I want for them. People come to see me because they have goals of living a long and vital life, and of course, of living a long and vital life means avoiding dementia for as long as possible, if not all completely. So I'm going to pause there and just have Rylan chime in on things. Rylan, any thoughts about what we've discussed so far?
Yeah, no, it's I loved, and I wanted to touch on the subject of, you talked about risk and the fact that it's only 40%, and a lot of people our minds tend to go to, oh well, why would I do that if there's a higher percent chance that it's not going to do anything. And we automatically look for the guarantee, right? Like, if it's not 100%, why would I take the risk, or why would I expend the effort? But another way to look at it is, why not do everything you can? Because if you don't do anything, then it's a 0% chance that you're going to avoid the risk. Why not do everything you possibly can, in your power, that you're willing to do in order to avoid this? At least give yourself, the chance, right? So that's my thoughts, to put towards that. There really is tremendous opportunity. Another thing I just want to emphasize is the stress. You talked about that as well. We tend to think of stress as an emotional thing, and of course it is, but there are very much physiological effects of stress that wear on your physical body just as much as it wears on you emotionally. And so take that into consideration, that when you're looking at your stress and um, considering self-care and, paying attention to your needs as well. Um, you talked about patients, especially, and, we've worked with patients who are caretakers for people with dementia. And whether you are, a caretaker now or, actively working to avoid dementia, it all goes full circle, because a lot of times when you are a caretaker, you forget to take care of yourself. And that's not, that's not going to get you, get you to be the best care for your loved ones. So make sure you pay attention to yourself and your own needs, no matter where you're at, because it's so important.
Yeah, not selfish. It's
Yes,
important. Yeah, like it's actually you can't give to others unless you're able to give, and you can't give, you're not able to give if you're not taking care of yourself. And yeah, but I also realize how challenging that is. It's easy for
yes,
me to sit here and, give that advice when I have, seen my patients in situations where they can't leave the house because they can't leave their loved one that has dementia unwatched, but they're too guilty. They feel they have too much guilt about putting them in a place that that an institution, for example. And I just have so much empathy for those people that are struggling with that, because the choices are not that neither choice feels good to them. But in the end, oftentimes it comes down to they don't have a choice because they've worn themselves down to the point where they're just not able to take care of themselves, let alone their loved ones. So that's the negative. And talking about the risk benefit thing, I think that's a really important thing. It's a hard thing for us to assess risk and benefits. We just don't have a really good calculator to do that. But I think if you can sit down, sometimes writing down risk benefits can be helpful to frame it in a way that you can, grasp it better. One of my favorite podcasters talks about this in he gives extreme examples of assessing that risk benefit when you're looking at interventions for your longevity or your health or those kind of things. And he says, okay, well, if he compares, going to get something in front of an item that's coming at you that is giving you risk. And, if it's a bag of gold coins and what's coming at you is a tricycle, well, the benefit's tremendous and the risk is really low. So you do that. If it's a penny in front of a speeding train, that risk benefit ratio doesn't make sense. Of course, these decisions aren't always that easy, but going back to what you said, like, what are the risks of being more physically active, of eating nutritious food, of minimize or moderating your alcohol use, of not smoking, of getting good sleep, of managing stress, of being socially connected? What are those risks compared to what those benefits are? I think when people can take a step back and really frame it like that, it makes sense. We we have a limited time here, and we
Yeah.
want, most of us want to maximize that time, both in length of time, but even way more importantly, the quality of time. These factors do both. These 10, the health span 10, that's what they do. We talk about a long and vital life, both long and vital being important there.
Yeah, and I think a good word would be the like risks, but also like just to explain it more is like the cost. What am I giving up to have this later on in life? And that's like the ultimate question of humanity, right? Like, what efforts am I going to expend in what am I going to gain from that later? And then we're constantly assessing that. And so when you start looking for the guarantee or looking for the absolutes, just remember, well, that doesn't exist, number one, but also, like, why not do everything you possibly can to,
Yeah.
ensure that you're going to be there for your loved ones in a way that's, contributing to the world, and control what you can control really well, and leave the rest up to the world, the
Yeah,
universe, God, whatever you want to call
it's,
it.
yeah, it's maybe a reframing here. When people are saying, okay, well, what's the guarantee that you're going to help me? I think maybe a better way is to say that the guarantee is going to come from you. It's not going to come from, this, your team, your people that you're getting to help you achieve this. There's one way you can guarantee that, and that's for you to be all in. Like, if you are going to do what, like, I've never had a client or a patient who followed my guidance and didn't have success. Never. Like, whatever that definition of success is, like, it's what we talk about is unequivocal. Like, nobody looks at what, eating healthy, being active, sleeping well, managing stress well, not smoking. I don't know anybody that would look at that and say, I don't know if that really works. I don't think
Yeah,
so. I don't think it really works.
it's science.
Yeah, it works.
Or it's
We're all in
like,
agreement. This is what
it's
works. It's really what can what resources do you need to get there, and that's the how. That's the part that I don't know. I think that's something that we have learned a tremendous amount about, and I feel like is now I understand the how. Now I understand how both I can do the things that I want to do to optimize my health, but also how we help others, build their own systems
mhm.
to achieve their health and weight and longevity goals.
I always ask the question, um, you know, when people are looking for a guarantee, it's like, number one, are you going to show up and, be open to, what we have to offer and what we have to say? But the other thing I think is getting help when you feel like it's not going the right direction and speaking up, when you have a setback, because it's change and growth and, developing new core habits in your life, or optimizing them, is not about, just following a protocol and everything's going to go smoothly. Like, there will be setbacks, and so going in with that expectation, and then also committing to reaching out for help when you have those setbacks, is another really big part of that, and understanding that and recognizing that as growth and not as failure, and or as like the opposite of success, is not true. It's so important. So I always ask the question, will you come to us when you're struggling? Will you ask us for help when you are struggling, so that you can get past this, level up, and grow in this aspect? So I just wanted to leave that out there as well.
Yeah, when you struggle, because you didn't say if, you said when,
Exactly.
because everybody will hit roadblocks. If they didn't, it would be easy, right? Nobody would be overweight, nobody would be in poor health, for their choices. if it was an easy thing to do, but it's not. I've thought about this a lot. I think we should do a podcast on this at some point. But when we're looking at behavior change, which is really what we generally are doing when we want to improve our health, whether you call that, oh, I need to eat better, I need to be more active, or I need to lose weight, or I need to quit smoking. All of those are changing behaviors, and the basis of that is that it's easy to make decisions in the short term that aren't consistent with your long-term goals. And so you have to find a way to make the right choice in the moment that is going to pay long-term benefits for you and be consistent with what you want to achieve in the long run. And how do you do that? Well, the easiest way is you develop habits, right? Like if you can develop it as a habit, then you don't have to think about it anymore. You just do it, and you get the right habits, then that leads to the long-term results you're after. How do you develop habits? We have lots of ways that we do that, right? You start slow, you build systems like what we emphasize in our program. You set your environment, you build it to your personal specifications, like exactly what you want to do. You have accountability, you have support. All of those things are what you do to build systems. And then it comes down to then what we do most importantly is get people through the valley of death of change, right? Like that's it. James Clear uses that, the valley of death, that time when you're putting in all this effort and there's just no results. You're just, you have to get through that valley of death. And then eventually it turns up and you skyrocket after that. Like you just take off and then it's easy to accomplish what you need. What was so hard before now becomes easy. That's what we do, is we get people through that valley of death and help them build the habits they need for the long term. We need to put all that together and do a podcast on that, right?
Absolutely. Yes. The discomfort and the struggles don't mean that you failed. They mean you're actually doing what you wanted to do.
Amen. Amen. Okay. Well, thank you all for joining us this week. If you're concerned about your risk of dementia, whether it's because of personal experience or maybe a genetic test, I just want to end with this. You have a lot of control. You have a lot of power in that risk for future, for future dementia. And if you'd like expert guidance, then that's what we do at HealthspanMD. Come see us, schedule an appointment. We'd love to talk to you and see if we could help you achieve your health and longevity goals as well. So next week, Rylan, what are we talking about? We're talking about our next
Supplements.
Supplements. That's right. Oh, this is a topic that I've learned a lot about. I went through the traditional medical, like I was just taught by all my mentors. Oh, supplements are a waste of time. They're a waste of money. Anybody who takes them are foolish. I have my own personal experience with supplements that provided amazing benefits for me, helped me change my mind to understand that there is an approach to supplements that can be helpful in helping people achieve their health and longevity goals. But what we also don't want to do is that polar opposite, the people that are taking every supplement, they have 25, 50 supplements, don't really know what any of them do for them, don't really know if they've helped them or not, and then put themselves at risk of those interacting, not having what they say they have in them. Like these are real concerns. What we're going to talk about is an intentional approach to supplements. So if you are taking supplements or interested in supplements or wondering about supplements, join us next time because we are going to answer those questions. So thank you, Rylan, for joining us. Thank you for everybody else, and we look forward to seeing you next time.
Take care, Dr. Hurst. Bye.
Right, bye-bye. This information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. Thanks for watching, and if you want to learn more about living a long, healthy life you love, click the link below to learn more about how we help people increase their health span. And if you like this video, hit the like button below, share it with your friends, and be sure to hit the bell and subscribe.